The Creative Work Studio is an arts-based occupational therapy community program at St. Michael's, but it's outside of the hospital. And I started it about over 15 years ago. When someone is struck or has a serious and persistent mental illness, they lose so many things. They lose their supports, their job, their friends, their family. Everything's fragmented. And so they have time though. They have lots of time. So we have people who come to the studio, not all of them, most of them aren't artists, but they discover their creativity. They discover their strengths. They discover their talent. And they have something challenging. That's so important, that they can use their abilities, their intelligence, to create something that they care about and that they could work towards. And they could get a reflection of themselves that says, I'm beautiful, I'm smart, I'm creative. And so I followed 5 of them across a journey of a year getting ready for an art show. And within that time, they all came forth and shared really vulnerable aspects of having and living with an illness, but how having a passion, having something creative can change their lives, having a place to go to, having other people that they could be with, having a safe place was all important in their recovery. Linda, who came to the program, said to me on my first intake with her, said, I'm giving myself 6 months to live. And I thought, wow, there's a lot of pressure here, but I said, okay. And she discovered photography through the program. And she had a camera, and she started taking pictures. And she surprised herself. And she continued to take all kinds of pictures, and they were amazing and beautiful. And we also gave her a mentor to work with, a photographer mentor, to help her really get better at her craft. And she blossomed. The challenges are money. The challenge is also the belief that something like this is really what's going to work. I mean, it's important that people have their therapists and doctors and go to their appointments and that, but then they need something to do. And it may not always come in the form of work, of paid work, because that's difficult. Some of our people do go back to work as a result of the program. But you need something, you need occupation. And that's the first thing that people have to understand, that we need to create resources, interesting, passionate resources for people so that they could come to and have their routine back. That's something that people really need to understand. That's important in the healthcare system, and especially in mental health. The next thing, you need money. The government, in our program, it's a hybrid program, so the hospital provides 40%. We fundraise 60%. The next thing you need is a space. You can't just have a small little room or a make-do room. You need a studio space, a real studio space, which we have. We have 3,500 square feet. But that space could be bigger, and it's not wheelchair accessible. Because of the film, there is a wide interest in learning this model. And so we've applied for a grant to take the studio out of the box. So now we're training the trainer. And we hope to go national wherever there's interest, and as well as local, to teach people both this framework, how to use the arts as part of a recovery model, and how to train the trainer, as well as how do you sustain, what are the logistics to sustaining such a program financially.